Cardiac failure can be defined as inability of heart to pump the blood in sufficient amount to meet the requirements of body. Some of the causes for cardiac failure are decreased coronary blood flow leading to decreased contractility, which can occur in myocardial infarction, valvular dysfunction, pericardial effusion, cardiomyopathies, and obstruction to the outflow as it occurs in case of hypertension or coarctation of aorta, and some nutritional deficiencies like uh, thiamine deficiency and beriberi. There are different types of cardiac failure. It can be systolic or forward failure, which occurs due to the weak pumping action of the ventricle. It can be diastolic or backward failure, which occurs due to the decreased filling of the ventricles. It can be high output failure, where in this type, although the absolute value of cardiac output is more than the normal, it cannot meet the requirements of the body. Compensatory mechanisms which can happen in cardiac failure. Baroreceptor mechanism. Cardiac failure leads to decreased pumping action of the heart. So cardiac output decreases and thus BP is decreased. This leads to activation of baroreceptors. The activation of baroreceptors leads to following changes. It leads to stimulation of the heart. This results in increased contractility. The stroke volume increases, heart rate increases. There is increase in the cardiac output results in increase in the blood pressure. There will be peripheral vasoconstriction. This leads to increase in the diastolic blood pressure. Peripheral venoconstriction leads to increase in the venous return, which increases the diastolic volume. Thus, the stroke volume increases, which increases the cardiac output. Adrenal medulla is a modified sympathetic ganglion, and when stimulated leads to increased secretion of epinephrine and norepinephrine in the circulation. Epinephrine mainly acts on the heart and blood vessels. Decreased cardiac output leads to renal hypoxia. Renin-angiotensin mechanism is activated and this will lead to vasoconstriction. There will be increased retention of salt and water by the action of aldosterone. This leads to increase in the blood volume and thereby cardiac output increases. Effect of Frank-Starling's law. In early stages of cardiac failure, operation of Frank-Starling law helps in increasing cardiac output. That is, decreased cardiac output, there will be increased end diastolic volume that causes stretching of the myocardium. That increases the force of contraction according to Frank-Starling's law, which increases stroke volume and cardiac output. The effect of Laplace law. According to Laplace law, where pressure is directly proportional to the 2 times of tension divided by the radius, where the P is transmural pressure, that is pressure across the myocardium, T is tension of the wall and radius. Transmural pressure is responsible for pumping action, and when radius decreases, the pressure increases. So the pumping activity is increased, so stroke volume increases and cardiac output increases. Decompensated heart failure. In spite of compensatory mechanism, if heart fails to pump adequately the blood after venous return, it is called as decompensated heart failure. It can be right-sided or left-sided or both-sided heart failure.